The YouTube live feed is up and running now. Jerome.
Yeah, I'm not.
You know how I turn my camera on?
Move your cursor to the corner of your square.
The way the YouTube feed works is if your video is on, you will appear in the feed on YouTube. If your video is not on, it won't appear.
Move your cursor to the corner of your square.
The way the YouTube feed works is
That's mute.
Oh. Start video. That says start, right?
Yes.
There you go.
Hey, Jerome, can you hear us?
Yes, I can hear you, Mike.
Cool. Just wanted to check. I'm going to mute us again until we come to questions.
Okay.
Thank you.
And we'll get started in a couple of minutes.
If you're not speaking, if you could mute your video feed, that would be good.
Is that the stop video?
Yeah, but you don't want to do that, Jerome. You want to leave yours on. If you're not speaking.
Okay. If you have the order of the conference, we'll start with Dr. Frankie Lourdes, then Dr. Hausman, and Dr. Hancock was not able to make it, then to Chief Jeffrey, then Kent Coster, then Mayor and Judge Executive. And then we have journalists online too, here with us with Zoom. And other people are viewing it on YouTube and through Facebook feeds. Hi, Mayor. How are you?
I'm scared to unmute or John's going to yell at me.
That's right.
I want to say hi to everybody too. Good to see you.
You too. It's been a while.
It has.
That's what's on my computer. Mayor, it's not as windy here as it was a little while ago when I seen you.
That was intense.
Hello, hi, Mayor.
Hi there. Good to see you again. Well, I don't see you yet. Oh yeah, I do. There you are.
Yeah, I'm hard to catch.
Yeah, sometimes though I look up your nose when you're on these calls.
I had to go fix my hair. That wind had it all mussed.
The
It looks
angle
nice.
is important, isn't it?
So important.
Okay, it's about 2:30, so we'll begin and we'll go down the order that I mentioned. And we have people viewing on live feeds with Facebook as well as West Kentucky Star's Facebook and YouTube through the Fiscal Court website. So good afternoon to everyone and welcome to the Paducah and McCracken County Emergency Management COVID-19 briefing. Mayor Brandy Harless and County Judge Executive Craig Clymer requested this meeting to keep you informed of the coronavirus impacts upon our community and to provide you with information on combating these impacts. And I use the word combat because we are in a war against a viral enemy that we must win. This morning's Today Show started with the headline, "From Bad to Worse," from bad to worse. All of us have experienced situations in our lives that went from bad to worse. Recent days, we've seen McCracken County move into the COVID-19 red zone as infections increase daily, which means the multiplication of viral carriers. The rise in positive cases increases our anxiety about the future. None of us likes uncertainty. Each day, the uncertainty of the virus affects everything we do. But as we have done in previous crisis events, we must counter the uncertainty with hope, and our hope lies in our faith, in medical advancements, and in our own actions. We hear a lot about following the science, but the science must be accompanied by our compassion for one another, best expressed with taking the familiar basic protective measures. Today, we want to provide you with the facts of the situation so that you know what we all are up against and what we must do to overcome it. We have assembled for you our community's leaders in medicine, public health, and emergency medical services, along with the chief executive officers of our local governments. We will begin this briefing with comments from Paducah Medical Facility representatives. And first up is Dr. Jenny Franke, Chief Clinical Officer at Mercy Health Lourdes. With the exception of the speaker, everyone else will be muted. And I will open up the conference for media questions at the conclusion of the medical briefings and then again at the end of all of the briefings. So Dr. Franke, welcome. And we look forward to hearing your comments. Thank you.
Thank you, Mr. Mansfield, and good afternoon, everyone. I think our experience at Lourdes Hospital really reflects what's going on throughout the region. In the last 3 months, we have seen the number of COVID positive patients hospitalized at Lourdes triple. At this point in time, over a third of those patients are requiring a critical care bed, and about 75% of those are on a ventilator. Oftentimes I see folks out in the community and they ask me, don't you think that the numbers are increasing because of increasing testing? Or don't you think the numbers are increasing because young folks are going back to college, et cetera? What I can say is that we are seeing a distinct increase in the increase of COVID positive patients across age ranges. We are seeing folks that have symptoms, that have serious symptoms, and the need for increased hospitalization and increased resources. So this surge has become very serious. At the same time, we're seeing folks with non-COVID related illnesses. So early on, we were asked to cancel elective procedures, and our ambulatory offices were closed and only open for virtual visits. The unintended consequence of that is that folks with non-COVID problems stayed home and they didn't seek medical care until they were even sicker. So folks that had chest pain or congestive heart failure, let's say a diabetic foot ulcer or COPD or diverticulitis, those kinds of problems where folks would have accessed medical care relatively early on, they were waiting until they were very, very ill and there were complications. So right now I can say that at Lourdes, we are working very hard to accommodate patients that have COVID and are ill with this pandemic, as well as those that have other problems. The other thing to consider is that as COVID spreads throughout our community, our staff are at risk of getting exposed and getting sick and needing to isolate. So that's putting an additional strain on all the hospital systems when their staff are sick and out of the labor force. The message that you will likely receive many, many times today during this conference is that we need to take this pandemic seriously. Before it's all over, we will all know of folks that have become ill, probably know of folks that had to be hospitalized and perhaps even who died of this disease. It's become very close to home and very personal. I know we're tired of it, we're all weary, but now more so than ever, we need to protect ourselves and those around us. Thank you, Mr. Mansfield.
Thank you, Dr. Franke, for your most timely comments. Next, we will move to Dr. Brad Hausman, the Chief of the Medical Staff at Baptist Health Paducah. Dr. Hausman.
Good afternoon. Thanks for having us. So I'll echo a lot of the same comments that Dr. Franke made. We went for many weeks, it seems, where our COVID volumes were fairly stable. Oftentimes we would have 6 patients, 8 patients, maybe 10 patients, but somewhere hovering around the single digits. But in the last few weeks, we've seen a drastic increase in the need for hospitalization. We spent a brief amount of time in the 20s, if you will, and over the last couple of weeks, seems like our inpatient census has been hovering in the 30s to nearly 40 COVID positive patients. Significant number of which are requiring ICUs and significant number of the critically ill folks on ventilators. Again, echoing a lot of her same comments, we're managing each day. It is requiring a lot of resources within the hospital, a lot of physical resources, staff resources to manage these patients, but we're able to do that daily and continue to provide for the care of those that we need to here in Western Kentucky. But now more than ever, we need the cooperation of the community in trying to limit some of the impact and the spread of COVID-19. So we talked early on and preached early on about the 3 basic things we always say: masking, hand hygiene, and social distancing, but it's really becoming an acute problem for us at this point. On one bright note, I will say a special thanks to Dr. Franke and Lourdes and to all the surrounding hospitals. Our partnership and communication is stronger than ever. We share information daily about how we're each coping, what resources we have available, and that's been a big help. We've had instances where we've been able to help out, and we've had instances where others have been able to help out us. So thank you to all the healthcare providers and facilities within the region for the work that they're doing.
Okay, thank you, Dr. Hausman. We have on your agenda Dr. Chris Hancock, hospitalist at Baptist Health. Baptist management advised me this morning that he's working and could not get away for our briefing this afternoon. We'll look forward maybe to talking to him in later briefings. Okay, next we'll move to emergency medical services. It's Mercy Regional EMS, which provides ambulance transport and is handling a lot of COVID-19 patients. So we welcome Chief Jeremy Jeffrey from Mercy. Welcome your comments, Jeremy.
Thank you, Jerome. Are you able to hear me?
Yes, I can.
Well, first of all, I'd like to echo what the Dr. Franke and Dr. Hausman said. In the beginning of this, we would carry 1 to 2 patients maybe a week or every other week, where we would see COVID patients actually in the ambulances and/or either confirmed or what we would call a person of interest. In the last 2 months, we're transporting anywhere from 2 to 4 a day, upwards of 10 at times. So I would like to echo what the Dr. Franke and Dr. Hausman said. Is very important that we take the personal responsibility to wear our masks, proper hand hygiene, and social distancing. It was in the beginning of this, it was kind of, you may or may not know someone who has had COVID or suspected of having COVID. I will tell you that now, I guarantee you, everyone, if we polled the room, that everyone would know someone who is either positive or has a loved one in the hospital and/or suspected of having COVID at this point. EMS has taken the last, since the beginning, and refined our cleaning processes to where we've got them streamlined, in every ambulance after every single call gets a strict disinfection to make sure that we don't provide any cross-contamination. This virus is real, it is out there. And the last thing we want is take someone who is not ill with COVID and exposing them to that. So we have streamlined our disinfection processes. And I would like to just tell the public that it is safe to get in an ambulance. It is disinfected and it is safe. Don't wait till you're too ill to call 911. Call 911 when you need us, because we are there. The ambulance is safe. The individuals coming to get you are safe. And that's what my message to the public would be. Don't be afraid of emergency medical services. Use us. Our expanded network of first responders, to include our fire departments, our volunteer, as well as the City Fire Department of Paducah, are staying up to date on CDC guidelines on how to protect themselves as well as the patients we're caring for. So that would be my message today, is to the public: you are safe to ride in an ambulance. You are safe to dial 911, and I continue to urge you to do so. Thank you, Jerome.
Okay, thank you, Chief Jeffrey. To conclude our section on medical and public health, we have Kent Coster, Director of the Purchase District Health Department, and he's in charge of this pandemic response from the public health perspective, which is historic. I was talking to one of our fire chiefs yesterday. We've had a 100-year ice storm, 100-year floods, and now a pandemic that had not happened in 100 years. Somehow we've hit the statistics during our tenures. And so, Kent, we look forward to what you have to say and an update from public health. Okay, Kent, can you hear me? You can go ahead. I think he's still muted.
Sorry, I was still muted.
Oh, there you go.
Okay. Thank you, Jerome. I first want to thank all of the healthcare workers in our community who work tirelessly in taking care of our family and loved ones, and putting their lives on the line for all of us. And my heart goes out to them. I have a wife who is a healthcare worker as well. And we certainly see every day, what each and every one of you go through. And we see it on the television. And it's just rips your heart out just to see, what they have to go through every day. And, we just want to thank you so much, for all your work. And we pray for your safety. As I've started out before with these meetings and briefings with some statistics, I'll share those with you. We have, in Kentucky, we have 142,000 cases. We've had 1,697 deaths, and our mortality rate has been 1.2%, which I think even our public health commissioner has said, even with all of the complications and health ratings that Kentucky has that seem to be, not as good compared to a lot of other states throughout the United States, our mortality rate is somewhat less, which has a lot to say, I guess, for our healthcare workers. So we have had in our long-term care settings 18,718 cases, and associated with that was 1,124 deaths, and that represents 66.2% of the total COVID-19 related deaths that are associated with congregate care settings. And we know that this has really been hard hitting to our elderly population. And so again, I just want to reemphasize that what we do and how we distance ourselves and wear our mask will certainly translate to fewer deaths and protections for our elderly population. So it's been about 9 months since we've had our first positive COVID-19 case here in McCracken County. And I've got some fairly alarming statistics to share with you, just comparing what has happened over the last month. So going back to like October the 19th, we had a total in McCracken County of 898 cases. And today we have a total of 2,185 cases, which is a 221% increase in 1 month. Our active cases a month ago was 107. Today it's 857. That's like an 800% increase. When I talk about hospitalizations, this is hospitalizations just for McCracken County residents. It's not for our region. When our hospitals talk about how many patients are in their hospitals, they're regional hospitals, so they're patients that are from other counties and other states even sometimes. But a month ago, we had 2 hospitalizations in McCracken County. And today we have 28. It's like a 1,400% increase. And our deaths 1 month ago were 13, and today they're at 24, and that's a 185% increase. And so I want to add too that is that McCracken is in the red zone with an incident rate of 70.8, which is about 3 times higher than the minimum rate of 25 that classifies a county to be in the red zone. And as of this last Sunday, there were approximately 94 out of the 120 counties in Kentucky that were in the red zone. So in response to these alarming statistics that we've been seeing across Kentucky over the past few weeks, our governor has put in place some restrictions, and we've all seen those restrictions as they were announced yesterday. So I won't go over those, but I know there might be some questions at the end of this briefing that I'll be more than glad to answer. One of the things that is kind of a bright light for us all is that we have 2 vaccine manufacturers who have come up with a vaccine that hopefully will soon be released. Of course, one that announced first was Pfizer, and they've now accumulated enough safety data on its vaccine, and so they're now preparing to file for emergency use authorization from the U.S. Food and Drug Administration. And so last week, the company released the early clinical trial data showing the vaccine is more than 90% effective. And I know Dr. Fauci said that one time, if he could just get one that showed 60%, he'd be happy. Well, this was 90%. And I think even within the last day or two, they're now saying that it is over 95% effective. And the other company is Moderna, and it announced Monday that their results from their clinical trials show that their vaccine is 94.5% effective. And so the company plans to apply to the FDA for authorization again soon after it accumulates more safety data later this month. And so Dr. Fauci, he told the media this week that we'll probably start seeing and getting the vaccine toward the latter part of December. So probably what will happen is that the FDA will probably consider both of these applications together, and considering that they both use the same technology and they appear to both have similar safety and efficacy results from their large-scale phase 3 clinical trials. So if the FDA authorizes the vaccines, they can be immediately distributed to the states, according to a presentation that was made last month at the U.S. Centers for Disease Control and Prevention. However, there can be no one can be vaccinated until a CDC advisory committee reviews the data, recommends the vaccine, and says which groups, will receive it first. So, the states are currently working out the details of running the vaccination clinics. The thing about the Pfizer vaccine is it's particularly complicated since it's got to be stored at a minus 75 degrees Celsius. And of course, doctors' offices and pharmacies typically don't have freezers that'll go that low. So the first groups that are expected to receive the vaccine are healthcare workers, the elderly, essential workers, such as police officers, and those with underlying medical conditions. One of the other things that has come about within the past couple of weeks, and we've actually put it into place beginning this week, is we're so overwhelmed with the number of cases and the number of contacts that we don't have the resources to keep up any longer with the contact tracing that we've been doing since the beginning of this pandemic. And I'd just like to read a statement that we would like to share with you from the Purchase District Health Department in response to this situation. So the Purchase District Health Department will exercise their public health authority in the best interest of its communities regarding statewide guidance and in consultation with the Kentucky Department for Public Health to promote an efficient, standardized, sustainable system supporting the Kentuckians of the Purchase District. In the context of widespread COVID-19 transmission, all citizens should assume they are at a heightened risk of exposure every time they interact with other persons within the transmission range of the disease. So rapidly identifying and isolating new COVID-19 cases remains a high-yield public health intervention to mitigate the unrestrained spread of the disease. All new COVID-19 cases will be contacted and provided written and verbal education related to exposure criteria. They are then asked to notify all family, friends, coworkers, and any others who may meet exposure criteria to self-quarantine for 14 days. Additionally, those asked to quarantine will be reminded of the importance of maintaining social distancing, universal mask use, hand hygiene, and immediate self-isolation if symptoms develop. The Purchase District Health Department is currently training additional individuals in order to accommodate the recent increase in cases. We ask that you be patient with us as we navigate this period of transition. In general, the Purchase District Health Department will not provide individual release from quarantine documentation. Instead, the Purchase District Health Department is providing standardized documentation to schools, employers, and other entities to educate and guide them in a safe return of persons to these environments. Widespread disease and public non-compliance with contact tracing both make traditional contact tracing impractical and low yield. Therefore, the Purchase District Health Department will focus on new cases, as noted previously, and enlist the participation of new cases to advise their close contacts of their possible exposure and need to quarantine. Contact tracing is still desirable to the extent possible, but when the public system is overwhelmed due to widespread disease, greater reliance on cases notifying their contacts and the use of assistive technology such as text, emails, etc., should be extensively utilized. Additionally, the Purchase District Health Department COVID response team is overwhelmed with the number of phone calls and messages that are coming in from the community. So please be patient with us. And messages are being returned in the order that they are received. So please don't leave multiple messages. Our team has been working around the clock, 7 days a week. Many of them are putting in, an extra week's work every 2 weeks. They're very stressed out. And many times I see them in tears, such as I'm sure we see our healthcare workers many times with tears. So I just want to impress upon all of those who, for whatever reasons they have for not following the basic guidance that we've been trying to educate our population to adhere to, that the number of people that are getting this virus now is escalating to the point that, just like was stated to you, that there's probably someone in your family or neighbor close by who has been exposed to COVID-19 and has tested positive, and maybe has suffered some serious health issues as related to that, as well as maybe even death. That it's your responsibility. It's all about, loving your neighbor and loving your family and, protecting them and, and taking the politics out of it. And please, I just want to reach out to you and just plead with you to begin utilizing these basic guidelines, because it's going to take all of us. We've seen some different waves. We've seen some different things that the governor's put in place. There's a lot that we can't enforce. There's a lot that he put in place yesterday that honestly is very difficult to enforce. Our health department can be looked upon as enforcing all of these. We have jurisdiction over the restaurants and over the bars to a certain extent, particularly if they serve food. So we can, actually, work with them and can actually close them down if they don't adhere to what the new restrictions are. But hopefully, as we've seen in the past, they've all complied pretty much. But we've seen a lot of our public who just haphazardly wear their mask or don't wear their mask at all. We've got pictures of people in restaurants and bars that are not wearing their masks, and the employees aren't wearing their masks. But we have others who have done a great job, in helping out and making sure that their employees and their patrons, are wearing masks. And so it's those others who have put us in jeopardy. And it's time, I think, for you to wake up and to help us all out. So that's all I have to say. Thank you.
Okay, thank you very much, Kent. I think I'll hold questions to the end and go on and move to Mayor Harless for comments from our local chief executives. Madam Mayor, please.
Well, thank you, Jerome, first of all, for coordinating this press conference again. And thank you to the judge for always being on the team with us, and especially to Dr. Franke and Dr. Hausman and Kent for the work you're doing in the trenches. I think it's easy for us as community members who are not in healthcare or not in public health to not quite understand what's truly going on right now in our community and in our Commonwealth. So thank you all for sharing the facts, as someone put it. I think that's so important now more than ever. I do want to say thank you to the healthcare workers. I just can't even imagine the grit and perseverance that you all are having to find to go to work every day, knowing that it's going to be hard. So thank you as well for that. I do want to echo what Kent said. Now is the time to put aside any doubt, any political question that you have, and to recognize that the leaders in your community are saying this is a problem and that we have got to respond to it. I will just wrap up my comments by sharing a little bit about City Hall specifically. We are closing city buildings as of tomorrow, Friday, November 20th at 5 p.m. This is in compliance with the 3-week plan that the governor put out yesterday. Just want to make sure that if anyone is trying to contact City Hall, that you can always call our phone number 270-444-8800. The property tax payments are being collected. A lot of people have shown up in person to do that, but there is a drop box at City Hall that you can continue to utilize. And then if you need a permit or to speak with fire prevention, you can also call City Hall to reach them. So we will be also taking steps in city government to make sure we're protecting our community and our employees and not perpetuating the spread of this virus. I really ask you, just like Kent did, this is a pleading and begging moment for this community. And when you hear that we went from 800 to 2,000 in a month, that should be enough to send a signal to our community that it's time to take this seriously. I'm going to ask one more thing for our community, and that is to think about your Thanksgiving plans. My family had to make the very tough call to decide that we're only going to have Thanksgiving with a small group of people, that we'll try to call our other family members and have conversations or try to do Zoom. It is a horrible sacrifice and it's uncomfortable, but it is an important one, because Thanksgiving could be a super spreader. And you heard the statistics today. We could show back up here in 2 weeks and you'd hear even worse statistics. We want to make sure that our local hospitals have the capacity to care for us. And if we continue to be negligent, they will not. So with that, I'll turn it back over to Jerome. And again, I'm thinking about all of you, and you're in my thoughts and prayers for sure.
Thank you very much, Mayor, for your comments. Next, Chief of our Cracken County Government, Judge Executive Craig Clymer. Judge.
Thank you, Jerome.
Sure.
The county is, we're talking, making an assessment about whether we're going to close. The governor has issued an order as to professional services, and the county offers some services that are different from the city, and so we're trying to balance the protections along with being able to provide services to people that they are used to getting and desiring. And so we'll be making that call perhaps this afternoon. But I just, we talk about it and talk about it. I guess the reason when we stopped these meetings was, the numbers were continuing on, and people were sort of doing what they were going to do. But with this escalation of numbers, it just comes down to we just have to renew and strengthen our resolve to fight this virus. You know, I was thinking, what's a way that we can maybe impress upon people or some example or something people understand? And I started thinking about, I played around with a little boxing back in college, and you know, I guess kind of a corny but say strikingly apt analogy is, you know, the boxer doing pretty well in a boxing match and guarding and keeping his guard up, but he gets tired midway through, lets his guard down and starts getting pummeled prior to the final bell. And like the boxer, we've been fighting this opponent for about 5 to 6 rounds now, March, April, May, June, July. It's been escalating some, but not too bad. Now we're dropping our guard. We're tired of wearing a mask, and we're tired of our freedoms being restricted. We don't like being told by government we can't do things we want to do, and have to do things we don't want to do. And so we're getting pumped. Final bell just down the road just a little bit. The vaccine's coming. I was greatly impressed, very surprised to partake in a federal government Zoom meeting a couple of days ago, in which they were not talking about the hope of getting a vaccine, the possibility of getting a vaccine. They were talking about how many, what the vaccines were, like Kent's saying. They were talking about how many is going to be in a box, how it's going to be distributed, how it's going to be stored, who's going to get it first, giving timelines. Man, we're right around the corner on getting some relief here. But we've got to get our guard back up, and we've got to mask up. If we mask up, keep our distance like the boxer, you know, guard up with the mask, your distance, social distancing, we can make it to that virus, and we'll be all right. This will be over with, and we can get back to a somewhat normal life. Thank you.
Thank you very much, Judge Clymer, for your comments. We'll open it up now to our broadcast and print journalists for any questions of anybody that's been speaking. We're glad to have Local 6 and News 12 and Paducah Sun and perhaps in West Kentucky Star online that I know of. So ladies and gentlemen, if you have questions, we'll unmute you and you may ask.
Yeah, I have a question. I have a couple questions actually. First of all, I have a question for Dr. Franke and Dr. Hausman. Do y'all know as of today how many COVID-19 patients are in your respective hospitals?
Okay, Dr. Franke.
Can y'all hear me?
Yes. Okay, Dr. Franke, I think you're unmuted now. I think Dr. Hausman had to leave.
The numbers of patients in the hospital, was that the question?
Yeah, as of
Yes,
today.
that's a very, very fluid phenomenon, but we've had 32 to 38 patients in the hospital each day for the last 5 or 6 days.
All right, and Dr. Franke, in terms of the number of beds y'all have available, has that reached a level yet where you're concerned about whether you're going to have like a shortage of beds?
I would say that we have really done a good job from the very early days of the pandemic in looking at a surge plan and identifying the numbers of beds, where we would put people, how we would allocate resources. The interesting thing is our most limited resource right now is staff, because staff are getting ill. And whereas early in the pandemic, if there was a surge in New York, they could ask for traveling nurses from Arizona or Montana or Tennessee. Now we're seeing an increase in cases across the country. And even though we are asking for temporary help for traveling nurses, et cetera, they're just not available. because every portion of the country is dealing with a surge. So we are doing the very best we can to not only accommodate the care of our patients with COVID, but as I mentioned, the other patients, certainly getting to a situation where we are starting to reduce the number of elective procedures is a possibility. We look at that several times a day. But that's our limited resource, not beds. It's nursing staff, really.
Are you concerned that it will get to a point where you just won't have enough staff available? I mean, I'm just asking, when do you think you'll get to that critical stage where you're just simply don't have enough staff?
Yeah. I have no idea on the when. My hope is that with communications like this today, that the community really hunkers down and really decides to make choices to limit their individual contact so that we can start turning this around.
I can give you the numbers of COVID patients by hospital as of today, in addition to what was given for Mercy. Baptist has 38. Caldwell has, Crittenden 1, Jackson Purchase 22, Livingston 1, Mercy had 38, Murray Callaway 10, and that's all the hospitals in our region.
Gotcha. Well, Kent, since you're on, you mentioned earlier about with the restrictions taking place tomorrow, you said there's things like, for example, the restaurant and bar restriction, you guys have jurisdiction over, but the other restrictions, for example, the ones with the indoor venues, the ones with the the theaters, and even just the social gatherings of having 8 people or less, I guess those are things that's, I guess, out of your jurisdiction, right? Are y'all involved in any of the other aspects of tomorrow's restrictions?
Well, even though that we don't have jurisdiction, we follow up on all complaints. And anytime anyone gives us a heads up on something that's taking place that we need to look into, most of the time we will investigate that. With like the bars, we can contact ABC. ABC has jurisdiction over the bars. For other businesses, such as, let's say we had an event center that we found out they were going to have something there, and we're going to have 150 people there. And we could call the labor department, and they have people who can go in and do an investigation. So we try to point resources in the right directions that can actually make a difference there on someone who is not following the guidelines.
So you're saying that, like, with restaurants, for example, they're not following guidelines, you guys can work with them on it, and they still don't, you guys have the power to shut them down. But when it comes to some of the other places like bars or event centers, you guys, once you get complaints on that, you guys can contact, I guess, various other agencies to respond to those complaints. Is that what you're saying?
Yes, that's what I'm saying. Yes.
Okay, gotcha.
Okay.
And
Chris, could you go maybe one more question? We'll see if anyone else has questions.
okay, I'm sorry, I don't mean to.
Okay.
Well, I guess my last question is just in regard to, with tomorrow's restrictions coming up in general. Obviously, every time there's any mitigation efforts, there's going to be obviously some aim to reduce the spread, but there's also going to be businesses who may be frustrated that here we go again. We have to shut down, things like that. I have a quick statement that I want to read. This is a statement from the Wade White, the Lyon County Judge Executive, and he sent out this to small business owners today. He says that, and I quote, he says, "Guys, I'm with you. I can't tell you how to run your business or navigate these ridiculous commands from the governor, but I trust you all to make the best decisions for your business. While Walmart and Amazon cash in, Governor Andy is going to string you all out in the name of sugar pill for the virus. I share your frustration of knowing while many government offices shutter their doors and cash payments sitting at home on the couch, you all have to work to put food on the table. Frankfurt doesn't care about your success, but still expects you to fill its coffers. I don't want the government in my doctor's office with me any more than I want the governor to tell you how to run your business. Hang in there. You all know so much better than Frankfurt how to stay safe. And I'm so proud of you, risen to take this thing on while the government weighs you down. And the reason why I asked that is I read that is because that's likely emotions that many other small businesses, whether it's in Lyon County or McCracken County, may share that kind of frustration when it comes to new restrictions. So I just want to ask the leaders in general, A, what are your thoughts on that? And B, just for other people who may be frustrated about the changes starting tomorrow, what's your message for them?
Well, I think I touched on it in my opening remarks. We're in this, and the Judge Clymer did too, we're in this balance between public safety and keeping the economy going. And that's why we're having these type of briefings, to make everybody aware of the facts so they can act properly and eradicate this virus as soon as possible by whatever method. And we know we can take protective measures now that can minimize it quite a bit. If someone is non-compliant, we try to appeal to their compassion for their fellow person to adhere to it and protect everyone. We know there's going to be disagreement on these type of issues, but in this city and county, we want to put forth the best measures possible, present those to everyone, and then support our responders and healthcare community and make the best response to this crisis that's possible. But do appreciate you bringing up comments from other counties and questions. I'd like to ask if anyone else has any questions, Brooke or Paducah-san.
I do. It's for Dr. Franke. I am wondering what it will take to store the vaccine. It might be too soon for you to know, but I was just wondering, is there enough room right now to store it at Mercy Health, or will room need to be added for this?
That's a good question. We anticipated the need for this, and Bon Secours Mercy Health, our parent organization, has purchased us the appropriate ultra cold freezer that we already have on site. So we are prepared to store enough vaccine for our associates, our patients, and really others in the community that might need it.
Okay, good.
Okay, thank you, Brooke. Anyone else?
Jerome, could I add one thing?
Yes.
I feel strongly that the best way to get our economy going again is for folks to become vaccinated. So the vaccine is right around the corner. There have been studies showing that as of a couple of months ago, that Americans, more than half of Americans were not likely to get the vaccine. I'm hopeful that with the current data that's come out, showing that both of these front runners in the vaccine are very, very effective, more effective than we ever could have anticipated, and seem to be very safe. I'm hopeful that that data really gets out to the public, and that the interest and willingness to become vaccinated is certainly higher than 50%. Once folks are vaccinated, if we can get the majority of the people in our communities and our region vaccinated, the virus doesn't completely go away, but our ability to have businesses open, still be safe, have more freedoms than we have now, that increases. So the key to opening the economy is the vaccine.
Yes, ma'am. Thank you. I think that's a good thought to carry as we close. And I urge us as we conclude here to remember the lives lost to COVID-19 in McCracken County and in the area, and to remember those who are recovering from this disease. Our healthcare professionals, emergency responders, and others continue to address this crisis with dedication, and diligence. So may everyone have a safe and healthy Thanksgiving season, and we'll keep you notified on when we have another conference.